Our structure actually is we are a subcommittee of the P&T committee. Like I said, we do kind of take care of those operational components, but and we have the more like the clinical review go through a different subcommittee. So really we're just focusing in on those operational pieces and really focusing into on the ones that we are foreseeing a challenge with, that won't necessarily fold into our normal processes. And so really it's just doing that analysis of, okay, taking inventory of like, okay, what does this drug require? What do we already have capability wise? And then, giving that back to the P&T committee with the clinical review that happens in a different committee. We have kind of two components now to the committee as well. And so it used to just be one committee, and these are like our, upper level leadership members. And so we have probably, let's see, probably like 4 or 5 people within pharmacy, like procurement, finance. We have clinicians, so they're expert opinions in terms of the operational aspects of things. We have an ethicist. We have finance from hospital side of things. We have executive leadership membership. We have contracting, IT. We do have some of the clinic leadership, so like ambulatory operations, that sort of thing. And then utilization management to help us with the payer plan information. So kind of what we would expect for authorization issues or anything like that. So I would say we have probably anywhere from like maybe 15 to 20 people, who are on the committee. We invite guests like as needed per topic. And then, so that's kind of like one aspect of the Emerging Therapy Committee. And then when we actually are onboarding a product, we form a work group. So the Emerging Therapies Committee meets monthly. The work group is going to meet more frequently, so weekly or maybe bi-weekly, depending on how fast we need to onboard something. And that work group is there to hopefully go through each of the little details that come up, just to make sure that the day-to-day operations have been thought about, and that if there's anything that needs to like circulate back up to the leadership, then that's identified early, and kind of just that cycle repeats again. And so that's kind of how we've structured it and found it to be pretty successful in terms of efficiency and speed in getting the drugs onboarded a little bit easier than before, when we didn't have, the right people in the room, who didn't know some of the day-to-day, or with the day-to-day people don't know, kind of from the leadership aspect. So that's kind of how we've managed that.